Zinc improves alertness, cognition, focus, memory, learning, recall, reduces brain fog, it's an antioxidant, it helps neuroplasticity, and it protects against glutamate toxicity. It's an essential trace element required for optimal brain health and cognition. It's integral to the synthesis of proteins, the regulation of signaling cascades, gene transcription and neurotransmitter transport, and it's involved in DNA repair and synthesis and methylation. You might think of zinc as a natural cold remedy or a white lip balm, but zinc is needed in small amounts every day to maintain the optimal brain function and the overall health. In practical terms, adequate levels of zinc in your system work as an antioxidant fighting free radical damage. It helps to maintain both male and female hormonal balance. It plays a role in neurotransmitter release, affecting learning, memory, and mood. When zinc levels are low, you'll feel fatigued, concentration will be poor, you'll get sick more often, and simple wounds won't heal. Zinc inhibits the NMDA receptors, and this reduces glutamate toxicity. And zinc modulates the activity of proteins, such as receptors and the enzymes that are involved in the regulation of macromolecules, the regulation of signaling cascades, and gene transcription and transport processes. Low levels of zinc are found in depression, and the lower the level, the more severe the depression. Zinc increases serotonin uptake in select brain regions, and this increases the efficacy of antidepressants. And it reduces depression because it increases brain-derived neurotrophic factor. Zinc is involved in preserving genomic stability by regulation of redox homeostasis, both oxidant and antioxidant signaling, DNA repair, synthesis, and methylation. Zinc inhibits the production of inflammatory cytokines, including nuclear factor kappa B, and zinc protects against cognitive decline due to toxic copper levels. Zinc is a trace element, and it plays an essential role in overall human health and cognition. It's required for the catalytic activity of around 100 enzymes. It's involved in immune response, protein synthesis, wound healing, DNA synthesis, and cell division. Adequate levels of zinc are crucial for growth and development, and they're required for proper taste and smell. A zinc deficiency is common around the world, including in the US. This deficiency occurs because we don't eat enough foods that contain zinc. Your body needs at least 10 to 20 milligrams of zinc per day because it cannot store the zinc. You get zinc from eating seafood like oyster and lobster. Beef, pork, and chicken provide smaller amounts of zinc, and it's also present in eggs, yogurt, cheese, and some nuts. But we don't get enough zinc from the food we eat, and much of the food contains phytates which block the absorption of zinc in the body. So vegetarians are particularly vulnerable to a zinc deficiency. Zinc plays a role in modulating your brain and your body's response to stress and depression. More than 100 enzymes in the body use zinc to help to make DNA, protein synthesis, and cell division. Zinc is also critical for the signaling between and within the neurons and other cells in the body. Zinc fingers are present in at least 3% of all of your cells. Proteins that contain zinc fingers act as interaction modules, and they bind DNA, RNA, protein, and other molecules. Highest amounts of zinc are found in your brain, particularly your hippocampus. A zinc deficiency can lead to symptoms of depression, aggression, seizures, violence, ADHD, and problems with learning and memory. A study published in the American Journal of Psychiatry shows that malnourished children exhibit a striking increase in behavioral disorders and aggressive behavior. Kids with nutritional deficiency demonstrated a 41% increase in aggression at the age of 8. At the age of 17, they demonstrated a 51% increase in violent and antisocial behavior. The malnourished kids weren't getting enough critical minerals like zinc and iron, or the B vitamins they need to develop a healthy nervous system. Levels of zinc have been found to be low in those suffering from depression. In fact, the more depressed someone is, the lower the level of zinc. Several human studies have demonstrated that supplementing zinc with SSRIs can help in the effectiveness of these antidepressants. One double-blind randomized trial with 44 patients with major depression were randomly assigned to receive zinc or placebo. At the conclusion of the 12-week study, the researchers found that zinc supplementation, together with the SSRI antidepressant drugs, improves major depressive disorders more effectively than patients with a placebo plus an antidepressant. Research in the last decade has shown that the presence of zinc in synaptic vesicles of excitatory neurons in the cerebral cortex and the hippocampus regulates synaptic plasticity. Long-term potentiation is a form of synaptic plasticity, and it's been shown to underlie learning and memory. And zinc in vesicles is critical to the proper function of these brain circuits. A zinc deficiency is associated with poor memory, and a deficiency impairs signaling of brain-derived neurotrophic factor, which is also involved in long-term potentiation and memory. One very recent study revealed the presence of zinc changes the dynamics of the release of neurotransmitters like dopamine on the neuron level. Zinc causes the cellular pore to close more slowly than usual, meaning the vesicle stays open longer, and it releases more of the neurotransmitter molecules. The researchers concluded, our results finally provide a connection between zinc and the regulation of neurotransmitter release. This could be important for the formation and the storage of memories. One Italian study investigated whether zinc supplementation could help to restore memory in stroke patients. 26 patients took 10 milligrams of zinc daily for 30 days. On day 30 of the trial, researchers found that zinc supplementation significantly assisted in the neurological recovery in the stroke patients. And animal models suggest that zinc supplements can increase resilience to traumatic brain injury for treating anxiety, depression, learning, and memory deficits caused by traumatic brain injuries. In this trial, rats with injury to the frontal cortex were fed either a zinc supplement or zinc supplemented diet. The rats were also given a zinc injection an hour after injury. The research team found that zinc supplementation may be an effective treatment option for improving cognitive impairment and depression following a traumatic brain injury. Zinc deficiency is a problem worldwide, including in countries like the US, for several reasons. Our modern diet typically includes a lot of grains, which are usually processed, packaged grain products like cereal. Zinc is found in the grains, but this type of zinc is bound to the phytates, which are naturally also found in the grains. This blocks zinc's absorption in the body. So zinc found in whole foods like grain and legumes are not a good source of this essential trace element. And the zinc you get from eating meat can also be blocked if your meal contains grains or other legumes. Eating high carbohydrate foods, especially processed foods, in the US and other Western countries are one of the reasons a zinc deficiency is increasing. If you're vegan or vegetarian, you're particularly susceptible to a zinc deficiency. If you have chronic digestive problems, leaky gut syndrome, or drink too much alcohol, you're in danger of a zinc deficiency. Zinc deficiency symptoms can include brain fog, craving for salty or sweet foods, eating disorders like bulimia or anorexia, chronic fatigue syndrome, hair loss, irritable bowel syndrome, impaired growth and sexual development, infertility and impotence, and hypogonadism in males, iron non-responsive anemia, hormonal issues like bad PMS symptoms, hyperactivity like ADHD, delayed wound healing, impaired adrenal function resulting in anxiety and stress, low immunity, meaning you get colds and flu more often, and pica, the urge to eat dirt, poor concentration and memory, skin disorders like acne, taste and smell problems, and weight loss or weight gain. All of these problems can happen at any age, including in the developing child, and they can be the result of not getting an adequate supply of zinc. Zinc plays a critical role in how well your brain and your body function. Adequate levels of zinc will increase your immunity and help you to fight colds. A Cochrane review concluded that the zinc lozenges or syrup are beneficial in reducing the duration and the severity of the common cold in healthy people, when taken within 24 hours of the onset of symptoms. Zinc is a potent antioxidant and an anti-inflammatory, and it helps to support healthy cell division and a healthy brain. Zinc balances the hormones, which have a direct role in not only your sexual health, but also in controlling anxiety, stress, mood, and sleep. Healthy zinc levels help to lower inflammation and oxidative stress. The endothelium, or the thin layer of the cells that line blood vessels, rely on adequate levels of zinc, supporting a strong blood-brain barrier and cerebral blood flow. Zinc is involved in protein synthesis, which is required by your body to use amino acids from food, needed for neurotransmitter synthesis and providing the energy needed for the mitochondria in every one of your brain cells. Healthy energy levels and avoidance of chronic fatigue rely on the adequate levels of zinc. Low levels of zinc are a biomarker for depression, and under conditions of chronic stress, you tend to get rid of zinc through sweat, urine, and saliva. So if you're depressed, you might want to try supplementing with zinc, especially if you're on SSRIs and other antidepressants. Research has found antidepressants and anti-anxiety medication work better when they're stacked with a zinc supplement. Many users report that supplementing with zinc helps to relax them before bed, and they sleep better. They recover from workouts faster. Many report that zinc helps to boost their libido. Zinc first thing in the morning seems to help many with energy and focus throughout the day. Zinc supports a healthy immune system so you can avoid colds and flu. And if you come down with a bug, zinc can shorten the duration of the illness. Some users say that zinc keeps allergies from flaring up, and many with skin problems say the zinc supplementation reduces the acne because it's anti-inflammatory and antibacterial. If you have adult ADHD, you may experience a decrease in anxiety or the perception of stress, and notice an improvement in mood. One thing to note from all the research is that improvements from using zinc only manifest if you're zinc deficient. With our modern diets, there's a good chance that you are deficient. The latest theory suggests that depression is associated with decreased neurogenesis and enhanced neurodegeneration, which is partly a result of increased inflammation. And lately, there's mounting evidence that depression could be related to decreased zinc levels. Zinc deficiency leads to less zinc in the neuron synapse, and this results in an increase in NMDA receptors. This can cause an overload of toxic glutamate. With an overabundance of glutamate, we get a decrease in GABA, brain-derived neurotropic factor and nerve growth factor. This excitotoxicity is thought to be responsible for seizures, migraines, dementia, anxiety, depression, and bipolar disorder. A double-blind, placebo-controlled trial in Japan worked with 30 women to study the effects of zinc supplementation on mood. Half of the women took a multivitamin, and the other half received a multivitamin with 7 milligrams of zinc per day for 10 weeks. The women who took the multivitamin and zinc combination showed a significant reduction in anger, hostility, and depression. The women who took only the multivitamin showed no improvement in mood. Another study with depressed, overweight subjects found that depression decreased in those who were supplementing with zinc. But zinc produced no effect on mood in those who were not depressed in the first place. Researchers concluded that the improved mood in overweight subjects was likely through increasing brain-derived neurotropic levels when using the zinc. In the last decade, several studies have been conducted on the role of trace elements like zinc and how they play in attention deficit hyperactivity disorder. Zinc is required for the production and the modulation of melatonin, and this helps to regulate dopamine function. So the theory is that those with ADHD may benefit from supplementing with zinc. A double-blind, placebo-controlled trial in Turkey was conducted with 400 boys and girls with a primary diagnosis of ADHD. Half of the group received 150 milligrams of zinc sulfate for 12 weeks, while the control group had a placebo. The study concluded zinc monotherapy was significantly superior to placebo in reducing the symptoms of hyperactivity, impulsivity, and impaired socialization in the patients with ADHD. Another study found that free fatty acids and zinc levels were lower in those with ADHD, but concluded they didn't know if zinc deficiency was the principal cause of the ADHD, or it was a secondary finding. A study in Croatia again showed supplementing with 55 mg per day of zinc sulfate, it helped reduce the symptoms of ADHD. Considering the major role that zinc plays in everything from cell growth to DNA synthesis to neurotransmitter synthesis and transport, and if your child is diagnosed with ADHD and you don't want to start them on stimulants, you might first want to try zinc and a good omega-3 high in DHA to see if you witness any improvement in their symptoms. Autism spectrum disorder, ASD, range from a severe form called autistic disorder to a milder form called Asperger's syndrome. If a child has specific symptoms of either of these disorders but doesn't meet specific criteria for either, the diagnosis is called pervasive developmental disorder not otherwise specified, or PDD-NOS. This complex disease can be inherited, but it likely also involves environmental factors. A study published in Biomarker Insights in 2011 worked with 79 autistic subjects to study the association between copper and zinc plasma levels and individuals with autism, Asperger's, and PDD-NOS. Participants in the study were tested for levels of zinc, copper, and antioxidants. Then, based on their deficiencies, they were prescribed the appropriate doses of the antioxidants like vitamin C, E, B6, as well as magnesium and manganese if needed. And they were given zinc picolinate daily for at least 8 weeks. At the conclusion of the therapy, those with autism and PDD-NOS had significantly lower levels of copper. All 3 groups had higher levels of zinc. Severity of the symptoms decreased in the autistic individuals followed by zinc and B6 therapy, with respect to awareness, receptive language, focus and attention, hyperactivity, tiptoeing, eye contact, sound sensitivity, tactile sensitivity, and seizures. Interestingly, none of the symptoms in the Asperger's patients improved after the therapy. A recommended dose is 30 mg of zinc per day, balanced with 2 mg of copper. The best food source by far is oysters. After that, there's meat, and then vegetables. However, the vegetables contain phytates which can block the absorption in the body. There's a simple DIY test first reported in The Lancet that can help to determine your zinc levels. You taste a teaspoon of zinc assay, and depending on how the liquid tastes, you can assess your levels according to their guide. Clearly, there's a sweet spot for zinc consumption, and more is definitely not better. More than 50 mg per day can throw off your copper levels, mess with iron function, and reduce immune function. Therefore, high doses are only recommended for a 1-week period if you're suffering from a cold or a flu. Zinc toxicity typically happens when you take too much zinc, and it can result in abdominal cramps, diarrhea, headache, loss of appetite, and vomiting. Antibiotics like Cipro and tetracycline interact with zinc, inhibiting the absorption of both the zinc and the antibiotic. Zinc can reduce the absorption of the rheumatoid arthritis drug penicillamine. To prevent this interaction, you should take your zinc supplement at least 2 hours before or after you take your arthritis medicine. Some diuretics can increase urinary excretion of zinc by as much as 60%. Prolonged use of these drugs can severely deplete your zinc levels. Zinc can raise your blood pressure, and too much zinc for men can be anti-androgenic and will inhibit the DHT, resulting in symptoms often associated with using the hair growth drug finasteride. Men should also note that too much zinc can dull the nerves, including the nerves in the penis, because excess zinc can over-inhibit the NMDA receptors. The bioavailability of different forms of zinc varies. So for zinc ascorbate, it's 15%, carbonate 52%, chloride 48%, sulfate 22%, bisglycinate 25%, citrate 31%, gluconate 30%, and piclinate 20%. So zinc carbonate at 52% seems to have the greatest bioavailability. Most importantly, the fine balance between copper and zinc is required. Zinc reduces the amount of copper that your body absorbs because copper competes with the zinc to bind with melanothionine, a binding protein that binds zinc into the cells. The ratio of copper and zinc in your body is more important than the amount of each. Zinc is especially helpful for treating anxiety and depression. Studies have demonstrated that zinc levels are low in those who are dealing with depression, and the lower the zinc level, the more severe the depression. Studies have also shown if you're having limited success with prescription anti-anxiety drugs or antidepressants, you may increase their effectiveness by supplementing with zinc. Zinc is also particularly useful in helping to alleviate the hyperactivity part of ADHD. Impaired impulsivity and socialization get a boost also. Zinc is also required for efficiently encoding and retrieving memories. Zinc deficiency is a problem worldwide, especially if you're vegan or vegetarian. But too much zinc is toxic. Keep your dose of zinc below 50 milligrams per day, and make sure to also take 2 milligrams of copper to keep your copper to zinc ratio stable. For more information about herbs, supplements, and natural treatments, check out my website.